morning. Today I'm going to be going ahead and demonstrating the nasogastric tube insertion. I just want to show that I have the proper name badge, I have the proper attire, my hair is up, I have no nails, I have no facial anything makeup, and I also don't have any jewelry. I want to let you know I also have the proper supplies for this procedure. I have the tubing, I have the suction, I have my lubricating jelly, my pad, my patient, some water, and a napkin for the patient, as well as my warm water basin. Okay, so first things first, I'm going to go ahead and knock. Come in. I'm going to shut the door for the patient privacy. I'm going to hand hygiene. I'm going to introduce myself while I'm placing my gloves. I'm going to say, hi, my name is Molly. Today I'm going to be your nurse. Do you mind telling me your first name and your last name? Perfect. And then do you mind telling me your date of birth? Perfect. I'm going to go ahead and just make sure that I have the correct patient and that your name badge, your wristband is the correct name and date of birth, okay? All right, perfect. Thank you so much. Miss Tupo, date of birth, January 9th, 2002. Okay, Miss Tupo, so today I'm going to be going ahead and doing a procedure on you, which is inserting your nasal gastric tube. This is ordered from your provider due to you stating that you do have a upset stomach. During this procedure, I'm going to be placing a tube from your nose to the back of your throat into your stomach. This is going to help relieve your upset stomach by releasing some of the gastric content that is in your stomach. And we're going to be testing that for you, okay? Do you have any questions for me? No? Okay, thank you. So I'm going to go ahead and give you some water and a napkin. Okay, I'm going to go ahead and place your bed up. And I'm going to place you in a high Fowler's position. In order for me to place this tube, I do need good entry into your nose and throat, okay? All right, so I'm going to go ahead and place this one. If you have any questions or any discomfort during this, just go ahead and let me know and I'll stop, okay? I'm going to need you to go ahead and basically flex your neck for me using your eyes looking up at the ceiling and your neck all the way back as far as you can. I'm going to go ahead and check your nostrils for any abrasions or obstructions. All right, perfect. There's no abrasions and no obstructions, which is great. So now I'm going to go ahead and make sure your vital signs are all perfect, which they're looking good. During this procedure, I'm going to have to go ahead and keep on your oxygen saturation, just for precaution to make sure everything is going good. Okay, and while that is going on, I'm going to go ahead and place your tubing into some warm water, and I'm going to get all the rest of my supplies ready. Do you have any other questions for me? No? Okay. Are you comfortable? Okay, perfect. All right. So during the procedure, you will likely gag. You are gonna gag once it hits your throat, the back of your throat into your stomach, and you might also throw up, but it's okay because I see it all the time. During that time, I'm going to stop. I'm going to have you drink water. And as you're drinking water, I'm going to go ahead and place the tubing 2 more centimeters in, okay? And now that your tubing has been in some warm water, I'm going to go ahead and measure your tubing. So we're going to start from, well, I am a left-handed, so it's easier for me to do it on this side. But if you would like to see it, I can just go ahead and work over the patient, which you normally would not do. To measure, you're going to start at the tip of the nose. You're going to go down to the top of the patient's ear, down to the xiphoid process. Okay. All right. Patient xiphoid process is at 55. This tubing does have markings, so typically you would not need a piece of tape to mark where you are at. But because I just want to do it for practice. I'm gonna put a pre-cut piece of tape on there so that I know when to stop while I'm inserting the tube. All right. Okay, sorry, the tape is very sticky. All right, it's at 55. All right, are you ready? Okay, go ahead, and I need you to do the same thing that we did earlier when I checked your nostrils, okay? And then before that as well, I'm gonna place this back in the water with it being lubricated. I need you to go ahead, place your head back, and I need you to put your index finger on your right nostril. I need you to breathe in and push out as hard as you can. Go ahead and do that on your left side as well. Okay, thank you, Miss Tupo. It does look like your right side has a stronger flow, so that's where I'm going to be placing the tube. All right, now that your tube is all good and lubricated for you, I'm going to go ahead and place it. Remember that your water is to the right of you, okay? Perfect. All right. I'm going to be placing end of the tube. Alrighty, Miss Tupo. If you start to feel, I'm sorry if it feels uncomfortable, but I can stop. If you need me to stop, just go ahead and say something, okay? Alright, so I'm gonna go ahead and start placing the tube. Okay, alright, patient is starting to gag. Go ahead and drink some water. Patient is drinking water, taking sips. I'm gonna go ahead and continue on placing 2 meters every single time that the patient is drinking water. Okay, now that I'm at my landmark, I'm gonna go ahead and keep it there. Gonna place the end of the tubing near the suctioning. While that's there, I'm gonna go ahead and make sure that the tube is stuck in a good place where it does not move. As you know, it might be really uncomfortable for the patient. Oops. Okay, perfect. Now that the tube is in, how are you feeling? Good? Okay, perfect. I'm gonna go ahead and tie, oh shoot. The tape that I have is not very good tape. It's not sticky because of the mannequin. It's not sticking to the mannequin at least. Okay. I don't know why it's not sticking to the mannequin. Okay. So now I'm gonna go ahead and place a pin on the patient's tube onto the patient's gown. I'm gonna go ahead and get some air in my suctioning. Make sure I have my basin to check the gastric contents. Miss Tupo, I'm gonna go ahead put some air in your tube so that I can get some of your gastric contents. And then I'm going to test it, okay? Right, I'm gonna go ahead and unclamp. You're okay? Okay, perfect. I'm gonna go ahead and reclamp. And I'm gonna test your gastric contents. Place that into my basin, throw that out. Gonna put in my pH tester. Okay. Alright. Perfect. It's at 3.5. You want a 3.5 pH level to a 5 pH. 3.5 to 5 level for the pH. Alright, I'm gonna go ahead and throw that away. How are you feeling, Miss Tupo? Good? Okay, perfect. I'm gonna throw that away as well. Sometimes we would allow x-ray to come and check the placement, but due to the gagging, I'm not gonna go ahead and ask x-ray to place it. Okay, and then now that that is done, I just want to let you know that You should not lower your bed more than 45 degrees. If you have, or if you're feeling uncomfortable, go ahead and press your call light. Your call light is to the right of you, and then one of us will come in and help you reposition. We do not want you at a lower position due to the tubing. It can move around due to certain positions. I will go ahead and leave this at the sectioning in order to have a good patiency in the tubing. We'll go ahead and continue on checking on the suction every 2 hours. You should feel some relief in your stomach as well. I'm gonna go ahead and clean up my mess. Do you want me to throw away your napkin, or would you like to keep it? Perfect, okay. All right, I'm gonna go ahead and take off my gloves. I'm gonna throw those away. I'm gonna hand hygiene. And you comfortable? You need anything from me? No? Perfect. All right, thank you, Ms. Tupo. I'm gonna go ahead and document how the procedure went, how the patient tolerated the procedures, my finding in the procedure, and yeah.